morning, Dr. Susanna.
Good morning to everyone.
Now, that's a very interesting choice of career, a veterinary acupuncturist. Like, why did you decide to take this path, doctor?
It's an interesting question because at the end of the day, I am a certified veterinarian from the University in Vienna in Austria, and I did practice as a normal conventional veterinarian and quite successfully. But when acupuncture helped me a lot, this piqued my interest, and I was like, maybe it's something that would also benefit pets. And luckily I had a good mentor, because a colleague who studied with me in Vienna, she moved to Hong Kong, she got married there, and she was the first certified acupuncturist in Southeast Asia, being from Austria. And I asked her, and I said, is there a course? And she guided me through, and well, that's basically the beginning of the story. I did the course, I became more and more interested, which was a lovely thing to happen. So instead of being like turned off by certain things like Chinese terms that are sounding a little bit strange, to be honest, especially coming from a Western culture. Mm-hmm. But I became more and more interested. And when I dedicated the first year after graduating to do only acupuncture, I really grew to admire what it can do for pets.
But how difficult is it to perform acupuncture on a pet? I assume they would be wiggling and not cooperating, right? Have you had any funny incidents?
Well, definitely I had many of my funny incidents, especially when I did house calls to start off with. I didn't set up a clinic right away. I needed to know whether this is something that can sustain. And when pets are at home, they are of course a bit different from coming to the clinic. But having said that, when I set up the clinic, I made it in a way that is very relaxing. So the premises where I perform acupuncture is extremely different from that normal, especially veterinary clinic, even from normal human clinics. People always comment, my doctor should have a clinic like yours. It looks a bit like a wellness clinic. It basically emits vibes that are calming and positive and tranquil. And that, of course, helps a lot. But it's also how you approach pets. And this is not directly related to acupuncture, but because I had to learn so many new things, it opened my mind. I also found out that pets understand much more, animals possibly in general, but my experiences with pets, than we give them credit to. So I actually talk with them, and even if it's only in my mind, and it sounds a bit hokey pokey possibly, but I feel it really makes a difference that they understand there is a kind type of medicine. So I'm not violating them for their own good. If you have kids, you kind of know when they get their vaccinations, it's for their own good, but they cry, they are scared, and they sometimes have to be held down. And I started to refrain from doing that and rather communicate with them and letting my vibes out. I'm really here to make it better, and it's actually quite pleasant. And it sounds like a little bit odd with all the needles involved, but the needles are not comparable to needles that we use, not the hypodermic needles we use in conventional veterinary medicine or medicine in general, but they're like fine like a hair. And so it's like less than a tiny mosquito bite when they go through, and pretty instantly you feel, and that applies very obviously to pets as well, a certain relaxation, happy hormones that start flow through your body. And interestingly enough, after the first visit, which already usually goes so well that the clients are like, my pet has never behaved like this. My pet has never fallen asleep in a vet's clinic on the table. And I'm like, yeah, well, I told you before, but you didn't believe me, right? And and then they remember that very soon. And within the third visit, they come in happily. They're very relaxed. So it's basically, acupuncture makes them feel right away happy. So it's actually not that difficult. And I make it a point that I don't have helpers or veterinary nurses that hold pets down and kind of violate them for their own good, of course. No, this doesn't happen in the clinic. It is purely a teamwork approach with the pet, of course, and the pet's owner and myself.
But what's the acupuncture for? Is it for its actual treatment, or is it only to relax them, or what's it for?
It's actually rolled all into one. The animals come in for treatment. It's actually mainly, I have very old pets, so it's geriatric treatments, meaning old age treatments, from aching bones, stiff joints, spine problems, lower back problems, to even ear disabilities of hearing, seeing, not to say that we can reinstall all the proper functions, but we can make it much better. Then, of course, we have chronic diseases like skin issues. That's the major staple. Kidney diseases, old pets mainly, but sometimes young pets, and supportive treatment for cancer patients.
Hmm.
Yeah.
Okay. What is the weirdest animal you've ever performed acupuncture on?
Well, I was asked many times, but I have to stick to what I really know very well, which is snakes, chicken, and cows and goats. Yeah, different. Well, so many different animals, but probably the weirdest ones are hedgehogs. Yes.
Hedgehogs shouldn't be afraid of needles.
They already have prickles on their back.
That's right. And it was because of that a bit difficult to acupuncture them. But snakes and chicken and all that, I didn't acupuncture yet. I had to say, you know what, it takes a lot of extra re-education on my part, and I had to skip that. But it's possible. Even fish is possible. Huh?
How do you acupuncture fish?
Under the water, I've seen it because when I attend my acupuncturist conferences, that's very interesting. Wildlife like eagles, whales. Oh my God, I have colleagues, they really do that. And one of my tutors is Dr. Steve Marsden in Canada, and he actually started out with acupuncture in the zoo. The giraffes and and they enjoy it as well. Also, you have to take your precautions, of course. They're wild animals, right?
But have you had an incident where you had to turn back a pet because they just weren't cooperating? Maybe they were just wiggling too much and you just cannot perform the acupuncture on them?
Yes, I had that. That was maybe in my 15 years of acupuncture. Dogs that are very wiggly. Sometimes it's the small dogs, and sometimes it's dogs who have major emotional problems generally, and they come for that. Actually, that was maybe 5 times, three to 5 times. I would say I can think of right now 3 times, but maybe there's 5 times, and I acupuncture probably overall 15,000-20,000 times. Yeah, and then when that was mainly, one was a cat, was very aggressive, and one was a large dog, was very aggressive and bit even the owner in the treatment room. And I said, you know what,
Oh, no.
this doesn't make sense, because I don't want you to go then to the emergency clinic, right? Just because you want for your pet acupuncture. And I also don't want to go to the emergency clinic, but it's actually really, really very rare. Yeah.
Okay. So you are like the pet whisperer. You can keep them calm and then put needles on them.
Actually, I make, it's a lot to do with the clinic setup, and it's a lot to do how people feel. So when you can make the pet owner, like in children, the parents, when you can make them feel at ease and you talk with them and you listen to their concerns and answer their questions, then you have the battle is half won already.
All right. Now, when you became a vet first, has this always been in the back of your mind, like to be able to treat pets gently, drug-free?
Your question is actually twofold, and to one, yes, and to one, I have to say no. Yes, it was always my intention to treat pets gently and to be their friend and to let them know I'm here to help them, to make this in my perimeter, the world a better place, so to say. But it was not in my mind that I would do it with acupuncture. Also, I attended a course in university. It was a voluntary course. It was acupuncture for cows and for horses. It was interesting, but because I decided quite early on, I'm not going to treat cows and horses, I concentrate on pets. So it kind of disappeared. And only when it really helped me so much, then it piqued my interest. And I thought, and actually originally I thought I will just integrate it as a complementary treatment into normal conventional veterinary medicine. But because it became such a hit actually along the time when I decided that 1 year I dedicate to acupuncture, that you know, I decided, no, I don't need to do conventional medicine anymore. There are lots of good, really capable vets who do that anyway. Why would I cramp the field in that sense? And why don't I just concentrate on something no one else is doing? And at that time, and until today, no one is doing acupuncture in a holistic term. It's a difference whether you just stick a few needles into a pet and basically look at the book where are the points and have a short course, and you'll find the points. Of course, you can learn that. everyone can learn it, but to really get the whole picture into your mind. Like, I use this point, which might be far away from the problem. Let's say there is an eye problem, but you know, if you learn acupuncture properly in the terms of holistic medicine, like the whole pet matters, then you know that eye point is actually on the small toe. And if you use that point, it will have the biggest effect on the eyes. But doctors or vets who don't learn that, they just, let's say you have an elbow problem, you just stick around the elbow some needles in. And if it's an acute problem that it came recently and it hasn't ingrained itself in the body, it might work. Yeah. But I see usually the chronic patients, and often I see patients that have been given up, like, I can't do anything anymore for your pet, you're not, might die, or you might want to put it down. And many people are like, no, I can see in the eyes we are not there, and it must be something. And then they come to me. And generally, I'm not a miracle healer. I wish I was, but I'm not. But I tell people, if you are not giving up, if you, that's why I encourage for pet parents to really tune into with their pets, and those who come to me, they are tuned in with their pets anyway, and say, listen, you will feel if your pet is not willing to move, you know, to fight on anymore, then it's all right. Then whatever is necessary, you do. I have never any problem with that. But if you feel there is not yet a time when things are so dire that the pet wants to give up and you are ready to give up, I'm not going to give up. And we go through this together. So it's basically a hand holding, and often it is palliative care. And I'm very honored, because I go through the most intense times of pet and pet parents together with them. It's very nice. It's very rewarding. Yeah.
Basically, when you do acupuncture, or you have to do a bigger procedure, the acupuncture, I mean, it takes the place of anesthesia. Does it do that, or?
It can. In my clinic, it's not, but it can. You usually use electroacupuncture. Yes, it can. And that was one of the things when Nixon visited in the 70s, China, where doctors also came along, and also a vet or two vets, and they actually founded the group, the professional group, International Veterinary Acupuncture Society, of which I'm a member of. They were so interested because they saw on cows, I don't know on other animals as well, possibly, but I remember on cows, being a surgery being performed, and without any anesthesia, just with electroacupuncture. And the cow was completely fine, was eating while they rummaged around in the abdomen of the cow. So that's when they were like, my God, this is really amazing, you know. And they brought it back to the US and started to study it in terms that also Western trained doctors, veterinarians, like myself, can learn and understand it. So they brought like a system into it that not only Mandarin speaking, Chinese language speaking people can learn and understand it.
Like you said earlier, there's no one else who is doing your job here in Malaysia.
No.
But are pet owners aware that there's such a service available for their pets, you know?
It's interesting that you say that. Actually, there is. My conventional colleagues have started to integrate acupuncture into their practices. It's also touted as an additional income stream as such. So, but no one has taken it to the height that I actually have taken it, as in like performing it in a holistic sense. And holistic, it might be a little bit an overused word, but holistic means wholesome. It means we treat everything in the pet. We don't just like look at the elbow, for example, but we look at everything on the patient, be it a human or be it a pet, and basically help the body to heal or to become so much better, to reach the optimal state of health at this point in time, with all sorts of natural helps like tools. Basically, acupuncture is a little bit like a manual in that sense, and tells the body, hey, you know, you need to restore your body to the best of your ability, but this is how it's done. So it kind of focuses energy, the healing power, from blood flow to detoxing the body. There's, from a Western point of view, there are different names to it. But let's just talk about acupuncture in that Eastern sense more. It's that healing energy that is actually focused on whatever is necessary, wherever it's necessary to be focused. And the tools are basically food and supplements and plant medicine. So this is a very different approach from suppressing symptoms, which we are trained to do in conventional medicine. And there's nothing wrong with it. And it has definitely, even in my life, a big, how should I say, a big role, because if if any acute problems appears, like, for example, a pet gets hit by a car, you're not going to go for holistic medicine and acupuncture because you need an immediate effective type of drug and medicine and procedure or surgery, right? Or if you have a headache that occasionally comes, you take a Panadol. I mean, you don't need to go for a series of acupuncture treatments. But if this is an issue that cannot be handled by drugs, and it shouldn't be just simply, it's very depressing because you just you suppress a symptom, like in skin issues. You give certain medicines like from steroids to other drugs, and anytime you stop the drug, it comes back again, and it's the same thing again. Sometimes it gets even worse. Then there is no more point in using conventional medicine and just suppress a problem. But then it's like, let's get and dig to the ground and get the pet better, or get the patient better.
But when you tell people that you are an animal acupuncturist, do you get curious or weird looks?
I do get weird looks, and people have the same questions that you actually ask right now. So I'm used to answer these questions. Yes, I do get, and I even get actually a little bit weird looks in terms that because I do only that. So I'm not even using any of the conventional medicine. In that sense, it's like I am a very unusual doctor. Even in my conferences, they're like, "You're really only doing that?" And then they're like, "Oh yeah, because you're practicing in Asia, that's why." I'm like, "No, that's not the reason why." And then they see Shankar and my husband, and they say, "Oh, he must be your mentor." I'm like, "He's not a doctor." But he comes in and very handy because he's the Asian when we go to very Western conferences about acupuncture. So I do get I have that weirdness factor about me, and that's also the reason why the clinic is very much set up in a professional manner.
But okay, being that you do only acupuncture for pets, can you make a decent living out of it just doing acupuncture?
With the help of a very good business coach, which shall stay unnamed here, yes. Yes, I mean, I have to be diligent and business has to be run very properly, but all the businesses have to. But yes, I can live off that. I mean,
how much does it cost to get a pet acupunctured?
Is it based on?
Well, it's based actually a very straightforward fee structure. All of it, firstly, we are only working by appointment, and all appointments can be and have to be made by the pet owner online on our website. So basically, what the pet owner sees right away, there are no hidden costs, because what you see on the website, that's exactly what you pay. The fees are definitely higher for consultation compared to conventional medicine, because the first visit takes 60 minutes, which is 4 times longer than in conventional veterinary medicine. It's even more than 4 times for many of my colleagues. 60 minutes, that is important because I need to get the picture of the pet. It's basically like puzzle pictures, right? Shankar, I think your WhatsApp things are coming through here. Anyway, so there are no hidden costs. So you pay, and that's it. That's basically, there is not like, you don't pay for consultation fee, a minimal fee, and then you go with 2 bags of medical stuff, from supplements to drugs, for another 5 times more of the consultation fee. You don't. That's not what works in my clinic. In my clinic, it's like this: you go online, you look at the services, you will see the first visit is 380 ringgit, and that's for 60 minutes. No other costs are applied. And there is another thing: there are no waiting times. I really, if you have to wait, there's a certain grace period. If you have to wait for me for any reason longer, the treatment is actually for free. And that also keeps me on the toes. Yes, this had to be done properly, because I feel waiting times, crowded rooms, crowded waiting rooms, they're completely detrimental to the healing process of pets and of patients generally. You know, when you're in your doctor's office and you wait and you are even getting an appointment, let's say you get one appointment by come at 1 o'clock, and by 2:30 you're still, I mean, there's still so many people in front of you. This is not only irritating, it's a waste of everyone's time, but it's also detrimental to your healing. You get angry, you get anxious. It's not happening in our clinic. You come in, you get seen, and there's never any crowds. So very easy with the MCO, or rather the CMCO and now the RMCO. There's no difference ever to to before, because we just never have any crowds. And coming back to the treatment fees, yeah. So it's basically you pay for my knowledge and for my helping you to guide you through. And the pet owner is very much involved. So it's not like, oh, let me stick some needles in. Okay, bye, 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 bye. That's not what happens, yeah. I do my stuff, and acupuncture is the only thing that I can do. But the rest is all how can we make together the life of your pet, how can we, should I say that? How can we make it in the best possible way that your pet enjoys and has great life quality? And that's not my task. My task is I guide you and I inspire you and I hold your hand as I'm talking about the pet owner. Acupuncture, I do fully on myself, of course, right? But there's so much more than just, okay, let me stick a few needles in. That's not all there is. Yeah.
What would you say is the most challenging thing about this career path, though, Dr. Susanna?
The most challenging part of this career path is to get not too attached to to patients and to keep up your positivity, because of course I see a lot of death and dying, and also to inspire people to do the right thing, because the simple things, the easy things are usually the detrimental things. Like let's just talk about food. For example, we are what we eat, and the pets are what they eat, and we are so used, and it's such a brainwashed field, I have to say. Oh, yeah, food from a bag or from a can, more so from a bag, is the food that every pet should eat to live a good life. And that's totally not true. And then trying to tell people or trying to teach people to change away from this, to go into fresh food. And then people are willing finally, and then find the time in our busy lifestyles to prepare fresh food. Because people can do the right. Firstly, food from a bag is not the be all and end all. It cannot be. Just think about it. Take a step back. Food is, for example, the food is 70 to 80% of the healing and of a good and healthy life is based on food. But it is challenging, as we all know, for ourselves to cook on a daily basis. We throw in, it doesn't have to be elaborate, but sometimes we just go out, and sometimes junk food is lovely. So making our own food is possible, but it's time consuming, especially if you have to stock up on a whole week and you're very busy. After our MCO, we are all going to be really busy again. I mean, that's how life works. So I notice people struggle with that as well. And that's where the food comes in. And that's where Feed Love comes in. Because Feed Love is the only holistically balanced and wholesome and truly premium fresh food brand that you get in Malaysia. You get, there is more and more people say, okay, I can make fresh food for my pet. Okay, why don't I sell it for other pets as well? But there is no science behind it. There has to be some science behind it as well. The auntie that cooks around the corner can, of course, design great meals for your kids and for your pets. But just because her kids grew up well with it and her dog didn't die of it, that's not necessarily what's the best thing anyway. That's currently how that industry is a little bit evolving. And I do understand the reservations of my colleagues, my conventional vets. I was like, what the heck is that? Shouldn't we just trust the big companies? And I'm like, okay, no, there is, it takes a hell of a lot of learning, but Feed Love is here to make this journey even more pleasant and more doable for pets. Right?
So there's always something new for you to learn, though, isn't there?
All the time. Maybe the biggest challenge is to keep up, to deal with life and death, because I do deal with a lot of death. I have really old patients, and I have I do palliative care. Palliative care is basically when you're end of life care. But the other thing is forever learning. You have to be a nerd, and I admit to it, I am a nerd. But you really need to like learning and being open to new things, and being also critical. And investing also a lot of money on courses that are not sponsored, because in conventional medicine we have a lot of courses, but many of them are sponsored by industries. In holistic medicine, we don't have that. In acupuncture, there is no sponsoring. You have to pay it all out of your pocket. And I tell this to my clients as well. You pay what you get. There's no one sponsoring telling me to tell you this or buy that. No, this is very objective knowledge, and it's constantly evolving, and it's super interesting. But it's a lot of work, that's for sure.
But what would you say is the best thing, though, about your job?
that animals like me finally.
What, animals didn't like you previously?
You know, have you ever, if you have a pet and you've gone to the vet can be the nicest person, but your animal doesn't think it's this way. They really try to just get out, and
Yeah.
they see the vet even outside of the clinic. They won't even go and say hello. It's like, no, I'm going to get an injection or a bad tasting drug.
It's
And
true,
in my
yeah.
case, it's like, I should post it out more, and I will update my website pretty soon, because I really have to, you have to see it to believe it, how happy they are when they see me. And that's really very rewarding. And the pet owners as well. And I love coming here, you know, after MCO, when we started with the RMCO, they say, well, I miss the clinic so much. Like, thank you. Did you miss me too? Yeah, but actually Maxie or whoever that is, you see how happy she is right now.
I gotta
So
bring
the
my
pets
old
miss me.
rabbit over, man, because my rabbit hates vets. So she's got
And
back issues and stuff.
the rabbits respond so well to acupuncture. Little pet rodents respond so well to acupuncture, even easier than dogs and cats. They're a bit more like horses. They are more straightforward. You see, dogs and cats, they take a lot from their owners on. It's a lot of layers and layers. Horses and also rabbits and guinea pigs, they respond so well to acupuncture, and they like it. They have no issue with it at all. You should really come.
Okay.
I hope I see you soon in the
I
clinic.
will. I'll be there. Yeah, yeah.
Now, Dr. Susanna, if someone were to be interested in following your footsteps, right, after listening to this interview, what would they have to do, and what is your advice to them?
Well, the first and foremost thing is learn, and I'll basically quote here my inspiration that I became a vet, or actually a doctor. I have to say, this was our village doctor in my little village in Austria. He was over 60, and he had a very successful career as a general practitioner for humans. And he was much loved, and he was the go-to person for pretty much all our 3 villages that are there in this very scenic area. And when he retired, or just before he retired, he started training in acupuncture, which was for those village people really like an odd thing. And I saw him as well, because just before I started studying, I went to him. He was the go-to person. He was the wise man. You could really go to with kind of everything, not only with diseases. And I talked to him, and he said, you know what you'll do? He said, you learn first and you practice conventional medicine. And he said, you want to become a vet, so learn proper conventional methods, go into science-based medicine. And he said, it's not non-science-based what acupuncture is about, but first learn the daily trade and practice it. So study and practice. And when then you feel the calling, you want to expand your knowledge, then go with a reputable organization and learn acupuncture and holistic medicine. And that's exactly what I did. So that's my advice to everyone. First, go and study hard and learn and practice conventional veterinary medicine. And then see whether your head is still, or your heart is still open to go into an alternative or complementary path. And then learn it properly, and then also dedicate yourself to learn it properly and practice it properly. Don't just do a weekend course. I don't believe in that. I think this is not fair to our patients to do a weekend course and then I'm like, okay, I stick a few needles in, and do it properly, because it's also much more rewarding for you as a doctor, and of course for the pets or the patients as well. So that's my advice.
Well, thank you so much,
Oh
Dr. Susanna. Yeah, bring
Thank you so
your
much
bunny
having me
there.
on.
Bring Denise there.
I will definitely do.
Yeah.
Because she's got back issues, so I'm gonna bring it over.
That's perfect. Acupuncture and our holistic approach will fix it and will make life so much better for everyone. Thank you for having me on.
Thank you so much.